welcome back to the program. Well, 3D printing technology is set to revolutionise medicine, from prosthetics and tissue engineering to customised medicines that are manufactured on demand. The University of Melbourne is one of many institutes looking to the future with their own 3D medical printing laboratory. At its core, 3D printing technology is used to create 3D objects, printing out anything from toys and food. And joining me to discuss this further is Dr. Chuen, who's a vascular and endovascular surgeon from the University of Melbourne. Doctor, thank you so much for your time today. Firstly, can you talk us through how 3D printing actually works?
Sure, certainly. The way that 3D printing works is it involves extruding a material, usually through a nozzle. That material usually comes out as a filament or as a layer. And then we essentially build up an object layer by layer. So what we're doing is we're constructing something out of essentially a type of liquid Lego block that builds it up into something that you can hold and you can manipulate.
And how is this sort of technology being used to revolutionise the medical field?
So what it means is that we can now design something on computer and essentially something that normally we would have to sculpt or shape using what's called subtractive manufacturing. We can use additive manufacturing or 3D printing to create something that we've just imagined or designed. So it opens the way for making all sorts of new medical instruments that we previously would find very hard to make. It also means that we can create things out of materials that we couldn't create before. And that means that we can use all sorts of novel materials such as biologically compatible materials, cells, things that we can implant into patients. And we can also personalise production so that small-scale production of things like hip implants that are much more suited to the particular shape of a person is able to be created instead of pulling something off the shelf that's mass-produced. And that really opens the way for personalised medicine.
And just on that, on the personalised care, I guess, will it help for more faster procedures, even less trauma for patients?
Yeah, so what we're talking about is that if instead of shaping a patient, so when we do an operation, instead of having to perform the operation and shape the bones, for example, in a way that fits a prosthesis that we, or an implant that we get off the shelf, what we can do is we can now design a prosthesis that fits that particular patient. So we may be able to do the operation faster, we may be able to cause less trauma, and we can actually do an operation that suits that patient better and achieves the desired result.
It's quite remarkable technology. Do you think that we could eventually see 3D human organs being printed?
Well, that's a difficult area. So we can certainly make things that look like 3D human organs. So, for example, for simulation or training, if we're trying to create something that a surgeon can practice on that feels and looks like a 3D human organ, we can do something like that. And there's a lot of progress in that area. As for something that actually works like a 3D human organ, so, for example, a kidney that you can just pick up out of the printer and then place into a human being, we're a long way from that. What we probably will be able to do is to create what are called organoids, which are tiny little structures that function like the basic unit of an organ. And we may be able to make enough of them that we can find a way to slot them together or put them together in a way that functions like an organ, so that it serves the purpose. It doesn't have to look like that original organ, but if it serves the purpose, then that's good enough.
And Doctor, people suffering from a range of ailments, such as the elderly, are often dependent on taking multiple pills throughout the day. It is my understanding that 3D printing is actually making it possible to replace all those pills with just the one pill. Is that correct?
Yeah, so what we'd like to see as we progress through 3D printing and we can put multiple materials into one object is to take multiple medications and then basically inject them into a pill that we design so that those multiple medications get released in a controlled way. So at the moment we see combined pills. So for example, there are pills for blood pressure where we take two medications and put them together into the single pill. Now what we can potentially do, and has been done, is to design that pill in a way that we can control exactly how long after ingesting it a certain drug is released, and then how long after that the next drug is released and at what dose. So it certainly means that we may be moving towards a world where potentially you might get a script from your doctor that gets sent to a pharmacist that 3D prints a pill or a series of pills that contain all of your medication.
And do you have a time frame on these developments?
Well, in fact, the 3D printed pill technology is already in existence. It is in very much a prototype model, and we have medicine manufacturing innovation centres in Australia and in Melbourne which are working on that type of technology already.
All right, University of Melbourne vascular and endovascular surgeon Dr. Chuen, thank you so much for joining us today.
You're welcome.